Hi, this is Dr. Campano. I'd like to welcome you to my office, and today I'm going to be talking about Miradry. What is Miradry? Is that some new antiperspirant deodorant? No, it's better. It's pretty miraculous, hence Miradry. It is non-invasive. It's a laser to completely eliminate underarm sweat, which is pretty amazing, I think. So people ask me, don't you need to sweat? You do. So when you think of perspiration, 2% of your wet sweat glands are actually located underneath your armpit. 98% is for the rest of the body. So you have the 98% to eliminate your excess heat. But 50% of these stinky sweat glands are actually located under your armpit, the apocrine glands, and the other half is located in the groin. So if you can eliminate 50% of those stinky sweat glands, you will be a much better smelling person overall. So people ask me, how did I get involved in, treatment of sweat? I do cosmetic surgery. So I do a lot of Botox cosmetic procedures. And some patients said, I have a lot of perspiration in my hands, a lot of underarm sweating. What can you do? And we can use Botox for that. And I do that for certain patients, but it only lasts about 4 months. So then we were looking, what kind of other treatments can we do? And I also do the smart liposuction, the laser liposuction procedure, where I take a laser and I'll melt fat. But you can also run it right underneath the skin and you're actually frying up those sweat glands. It is an invasive procedure, and that again lasts about 6 months. So it's not a permanent procedure. So I was looking in the literature and the medical conferences where I go, and Miradry came up about 5 years ago. But at that time, they were just using a topical numbing cream. And so when patients were having the procedure done, the doctors weren't able to turn up the power level high enough to get a really good efficacy. So it wasn't as effective. Now, a smart person said, hey, we do liposuction and we use what's called tumescent anesthesia, where we inject numbing medicine underneath the skin, completely gets rid of all pain, and then we can put the Miradry laser on and we can crank it up to a full power, and in one treatment, you can have permanent elimination of underarm sweating. So people asked, if I use my antiperspirant deodorant, isn't that enough? But then a lot of people say, but why do I have to keep reapplying it? It feels like it wears off. So in order to receive FDA clearance, you actually only have to eliminate perspiration for an antiperspirant 20% of the time, which means we're uncovered 80% of the time. And then clinical strength antiperspirants are 30% effective. So patients will have the procedure done, and you just come to the office. It'll take about an hour, maybe an hour and a half for your procedure. And then afterwards, you're going to have some swelling under your arm, so you just put some ice. I personally am actually a patient, so I do all my Botox, my lasers, and my fillers. So I said, I need to try this Miradry procedure as well, because when I go to the gym and I exercise, I just don't want that underarm sweat and kind of the odor that's associated with it. So I was a patient, had my procedure done 2 weeks ago. I didn't even need a Tylenol, and it was a little swollen, and I used some ice. And, now I don't have underarm perspiration. So 80% of patients will have complete permanent elimination of underarm perspiration. Now the other 20% may require a second treatment, which we'll do 3 months later. And again, they know what to expect, so it's pretty straightforward. And we have a lot of patients say, is this right for me? Is this something I want? Pretty much anybody, not just patients who say I excessively sweat. When I'll do a lecture and I ask patients, who here has worn deodorant this morning? And pretty much 100% of people will raise their hands. And then when you ask people, how do you feel about using these toxins? So a lot of us are trying to eliminate aluminum products and other things and try to go back to natural products that we're using on our bodies, because we find out more and more things like, oh, this is not so safe, this is not so safe. So people are trying to be a little bit more homeopathic about things. So a lot of patients feel that it's uncomfortable to not use the product, but they don't really want to use those products. And then you do the sniff test. So a lot of us, if we're out and about and we think, oh, is our deodorant still working? So you kind of sniff and check, and immediately I pass my sniff test. So we're here in the high desert. It's 105 degrees outside. It's a dry heat, but it's hot outside. So I try to walk my dog at night, and I'm waiting for it to cool down, and it's 90 degrees. Finally, I'll take him out. And then I came back last week, and the rest of me was pouring with sweat, my head, everything, not my underarms. I was completely dry. I was actually really shocked that I was completely dry. So it's a really great technology. Simple, non-invasive, anyone can have the procedure done, and a bonus is you actually lose about 70% of your underarm hair. So for women, we'll just couple it with Mira Smooth, and I would personally like to offer an additional discount for our sheriff deputies, police officers, fire personnel, as well as active duty military, because we'd like to support those people who take care of us so well. So please come on down to the Campano building and we can perform a cosmetic consultation for you.